Welcome back, everyone, to another PT Pro from the Optimal Body Podcast. I'm Dr. Dom.
I'm Doc Jen.
And today we're going to be talking about ankle sprains, specifically chronic ankle sprains, or when you feel like you're constantly rolling that ankle time after time. Why does that happen? How do we develop that pattern? Stay tuned.
All right, diving in on those ankle sprains, but more so, we're going to talk a little bit more about chronic ankle sprains and how they develop, what signs and symptoms you can start to kind of look for to know if you rolled an ankle, how do I make sure that it doesn't turn into either chronic pain or chronic rolling?
Yeah, I always do this, right?
Yeah.
I always roll my ankle. You feel like you run into those people who are just the chronic ankle rollers, or they have this chronic instability of the ankle. And that's something that we're really finding develops from people who have this specific type of ankle roll.
So let's talk about the different types of ankle sprains that can happen. And one of the most common ones, up to 73% most common, is your lateral ankle sprain. Mm-hmm. So that's happening to that anterior talofibular ligament right there on the outside of that ankle. So think of that model walking down the runway and that heel just kind of comes out and that ankle rolls. That's the most common one we see, right? And that really cringy one that no one wants to see.
Yeah, like when you're watching the basketball replay and the guy's ankle touches the ground on the outside. And it's one that can look kind of gruesome on replays, but is the most common. Then we also have the medial ankle sprain on the inside, or the medial side of the foot is where we have the deltoid ligament. It's this big, really
that one's thick,
strong, thick ligament on the inside of the ankle. Also, our medial malleolus sometimes is a little bit longer and will sometimes have a bony block on that side. So the medial side of the ankle is just kind of seen as a lot more stable, which is another reason we see a lot more of these lateral ankle sprains.
Yeah.
Grade 1 is not necessarily any tearing, but they were just stretched beyond what they're used to. Grade 2, there's some tearing of the fibers. Grade 3 is complete tearing of whatever ligament it is that we strained.
And what we see is that acute sprains are amongst the most common type of injury to the body. And there's 70% develop residual symptoms.
Residual symptoms meaning anything like soreness on the outside of the ankle, just a feeling of soreness up on the outside of the leg, instability, a little tingling. And some of those residual symptoms can include this chronic ankle instability. Up to 20 to 40% of people who have a first-time acute ankle injury can develop into this chronic ankle instability. So how does that happen? Why does that happen with people who just have this acute injury?
Athletes obviously make a high percentage, women a little bit more than men. But I think the statistic that was interesting too is that 50% of acute ankle sprains show up in the ER that are not athletic based. So think about the people just hiking or stepping off a curve and roll their ankle. It's not even due to sports or athletics. And that's 50% of the population.
Spoiler alert, one of the biggest risk factors is having rolled your ankle once. Having any acute ankle roll is the largest risk factor of rolling again. Often, what do you think they get in the ER? Oh yeah, rest it, stay off of it, take some anti-inflammatories or something to get the pain and soreness to come down. And then they might do nothing beyond that.
Especially grade 1.
Totally. Pain will come down. They'll be okay, it's a little sore to walk on it. But still, like you had mentioned, 70% of these people develop residual things that might hang around with them. So how can we better prepare these people who just have a one-time ankle roll to do the things to help them prevent from or reduce their risk of developing chronic instability down the road? That second time we do it, we could already be developing those chronic ankle instability patterns.
Yeah.
If we aren't right on top of it to start trying to, okay, how do we inject more stability into this ankle? Even if some of the ligaments and tendons have some loss of their integrity.
Totally. Because when we look at some of the symptoms that we kind of want to look out for before they turn into chronic is a loss of postural stability. So even just standing on one leg, balance, support, your muscle reaction time. So how quickly that your muscles respond when you're doing landing or jumping or running or hopping. And then just the strength in general. Could you even heel raise as many times as you can on the other side? So even just that strength aspect starts to starts to go down. And these are some of the symptoms that we want to start to look for when we're talking into gradually going into that chronic stage of instability in that ankle.
And some of the tests that you'll see people use for this, like you mentioned, postural stability. So a good way to test for that, like you said, just standing on one foot, sometimes after an ankle roll, and people are still noticing these residual symptoms. You can tell like, hey, I don't have pain, but even when I stand on my ankle that I rolled versus my foot that I didn't, it's harder. Like you have less of that postural sense of where you're at.
Yeah.
People will use the star excursion, which is this test where you stand on one leg and then you reach in all directions out to the side at every diagonal with one leg, and you kind of measure how far you can reach in each direction, and then do it on the other side and see how different they are. So again, if you have much worse on the side that you had rolled your ankle on, that might put you at a predisposition of like, oh, they might develop chronic instability. If you're having difficulties jumping and landing and stabilizing on that ankle, that is, a risk factor that would show that a predictor that you might develop chronic instability because of that initial episode. Again, lots of people still having issues 2 weeks after rolling their ankle. Different types of instability when we talk about mechanical instability versus functional instability. We can have mechanical instability once we start rolling this ankle, or we've done it multiple times. That ATFL again, like mechanically, it's going to have a lot more laxity in it. We might not be as worried about mechanical stability as we are about developing this functional stability. And I think that's where Jen and I would both go if we were working with somebody who had recurrent ankle sprains throughout life.
Yeah.
We'd be like, how do we develop the best functional stability we can here?
One piece of advice we're going to continue to give is get strong, stabilize, work. That is the only thing that we can do for lax ligaments. So that's what we're going to continue to do for the ankle as well. And beyond just getting strong, because that's part of our conservative treatment, right? So now what do we do for these chronic ankle sprains? Well, we do want to do conservative treatment. We want to reduce any pain, swelling, just like we would with any acute injury. We want to make sure that we have range of motion, right? And then we want to start to restore some of the strength and the function, and we want to progressively start to overload that. We want to make sure we have balance and sport-specific exercises, dual tasks, all this stuff. But beyond just strengthening, and something that, we think is important to understand when it comes to, especially to something that is reoccurrent and chronic, is that we want to start to repattern the way that our brain and our muscles are working together on different surfaces, in different areas, in different functional activities. So how are we connecting this brain muscle connection so we don't have to think about it every time?
Yeah. Humans and movement are messy.
Yes.
We like to think that we can train ourselves in a gym or train ourselves in this controlled environment for our sport, for our activity, and then go out into the actual real world in that sport or that activity and just do it exactly as it was in the gym. But in reality, when we're hiking, when we're out and about, when we're on the football field or the basketball court, it's a very unpredictable environment. And we might suddenly do a skill we've practiced 1,000 times and the ground might be slightly different when we land, or we might land on somebody's foot. So how can we start to, like you're saying, train the body to be ready to support in those types of new, different situations, more challenging situations?
There's a lot, and that's where it comes to dual tasking as well. Like, how can we distract our brain as well, like when we're doing something else but making the ankle work, right? And
Totally.
that's so important when it comes back to that. The brain works cross-sectionally to our body, right? It works in kind of this X pattern. And so there's actually practices as well where we could take this little piece of paper and put a black X on it and hold it in front of something. So whether you're holding it or you have it in front of you and you're doing these higher level ankle activities. Okay, how can we work on the skills that your mind continues to want to guard you in, but now we're looking at this X, and that actually is repatterning the brain as well. And so now we're developing, which we've talked about before, different neurotags within the brain to respond to the tissue differently and develop this more subconscious way of being able to move.
So you're thinking about buried treasure because of X marks the spots instead of rolling your ankle. And that is science,
that's what
folks.
Dom is thinking
That's
about.
Science, folks. We're such habitual beings that we'll be doing something and our body will habitually go in a certain direction because we're used to it, even if it means rolling our ankle again. So how do we do these things to start disrupting that pattern? That's one of the first difficult things. And then training a different pattern on top of it. Really building the strength back, building the range of motion is only half the battle with these, especially with these chronic, unstable ankles. Coordination is where we need to go with the training.
Yeah, retraining their brain. Another fun one that I like real quick is if you put like a triangle in front of your face and then you bring it to an eye. So who knows what eye it goes to, but whatever eye it goes to, that's your dominant eye, right? And so then you close your dominant eye. I actually cannot close my eye. Working on that, okay?
And this is if you're focusing on one thing, right? If I'm focusing on like a dot in the room, and then I bring the triangle up and keep the dot in the triangle, and then bring it to your eye, right?
Yes.
If you're trying to follow along at home.
Find your dominant eye, close your dominant eye, or like if you're like me, cover it. Whatever, don't make fun of me. And then do whatever task you're trying to do in rebuilding strength and rebuilding coordination, whether it's standing on a leg, hopping on a leg, doing a skill or whatever it may be. And you're doing it now, but making your brain have to work harder because you're using your non-dominant eye to have to work and visualize things. Again, we're retraining the brain in these different patterns as we're retraining movement.
And again, getting with a physical therapist, getting with a movement expert to get some better ideas of how you can really take it to the next level and how you can turn this ankle story around in your head. I think a lot of it is, hey, I've been rolling my ankle my whole life. It's just going to keep happening. Like that can't continue to be the story.
No, change the story.
Yeah, we really need to start to give people the tools to take control back, feel empowered to feel stable on their feet.
Yeah. Thanks for joining us on another PT Pearl from the Optimal Body Podcast. I hope you're enjoying it and you're learning a lot. If there's more questions that you have, you realize things are popping up, or you've heard things from your friends that you just want to be able to help them out with, drop your request below so that we understand what you need and we create more podcasts on it.